Post-operative instructions. Today and for the next 3 days, spray your new hair with sterile normal saline every 30 minutes, except for the time when you sleep. Do not touch the transplanted hair. Tomorrow, wash the back of your head only, that is, the donor area. For the first 2 days, wash your head gently with your fingertips. Don't scratch the dry skin with your nails. Also, for the first 2 days, rinse it with gauze soaked in saline solution. On the 4th day, stop spraying your new hair with normal saline and wash all your hair. For the first week, wash your hair every day in the morning and evening with a silicone-free shampoo according to the provided instructions to remove small pieces of dry skin from the recipient area. Here are the washing instructions. Wet your hair with lukewarm water. Put some shampoo on your hands and rub to make foam, and then put it on your new hair. Touch your hair gently and leave it for 2 minutes. Using only your fingertips, wash your hair with small circular movements, gently massaging the scalp for 3 to 4 minutes. Rinse your hair with lukewarm water. Wash your hair again using the same steps. Wipe very gently with a clean towel. Use a silicone-free shampoo for the first 2 months. Most shampoos for kids are silicone-free. During the first 10 days after the procedure, wash your hands before you touch your new hair. During the first month, avoid letting water hit your head directly. On the 10th day, start washing your hair every day just like you used to do before the procedure. After washing your hair, apply minoxidil 5% on the new hair only, 2 times a day in the morning and evening, for at least 1 year after the procedure to stimulate the growth of new hair. Take precautions. For the first 4 to 5 days after the procedure, sleep on your back, stomach, or on your side. Use a small, appropriately shaped pillow or roll up a towel. The transplanted hair is easy to pull out of the skin even just by rubbing against a big pillow at night. If you smoke tobacco, try to reduce the number of cigarettes you smoke during the first 3 days. Do not drink alcohol for 5 days after the procedure. Do not wear hats during the first week. It is easy to damage hair follicles. Do not bend forward too much, for example, to tie your shoes. Put on your shoes while sitting, not standing. Do not use chemical styling products like gel, hairspray, or paste for 1 month after the procedure. Avoid exposure to strong sunlight for 3 months after the procedure to prevent burning the scalp. For protection, you can wear head coverings or use sunscreen. Avoid getting your head wet in the rain for 7 days after the procedure. Avoid swimming in the sea and in a pool for 1 month after the procedure. You can start doing exercise 10 days after the procedure. Eat foods that are soft and easy to chew on the day of the procedure and during the 2 following days. Do not chew hard things and do not chew gum. On the day of the procedure, you may experience loss of sensation in your scalp due to local anesthesia. Be careful when getting into and out of a car to avoid hitting your head on the frame. Wear clothes with a zip or buttons instead of tops you have to pull over your head. Remember your medicines. Take Medrol tablets as directed by your doctor. Importantly, while taking the medication, avoid consuming salty foods. Despite taking the medication, swelling may occur. You can apply cold compresses to the forehead. A compression bandage placed around the forehead to reduce swelling in the upper area of the scalp may also be helpful. Use it only during the day. Spray the area of the implantation with neomycin twice with a 3-hour interval on the day of the procedure. Spray the donor area and the transplanted grafts for 3 consecutive days after the procedure, every 3 hours, 4 times a day. Do not spray with saline solution for 30 minutes after using the antibiotic to avoid washing away the medication. You may use painkillers. You may use 1 tablet of ibuprofen or paracetamol if you experience pain. If, after a few days, the skin is tense and starts to peel, you can use light moisturizing creams. You can also use a moisturizing shampoo. The first hair will start to grow back 3 to 5 months after the treatment. The final effect should be expected after 10 to 12 months.